Welcome, I'm Dr. Singh. Today I'll be covering rash, clinically known as dermatitis. Dermatitis, Herpetiformis, or DH, is a chronic skin condition that causes itchy blisters and rashes. It is also known as During disease or gluten rash. DH is an autoimmune disorder. This means the body's immune system mistakenly attacks its own healthy tissues. In the case of DH, the immune system reacts to gluten. Gluten is a protein found in wheat, barley, and rye. DH is closely linked to celiac disease. Celiac disease is a digestive disorder where gluten triggers an immune response that damages the small intestine. Most people with DH also have celiac disease, even if they don't have noticeable digestive symptoms. The exact mechanisms of DH are still being studied. However, it is clear that gluten plays a major role. DH can affect people of all ages, but it is most commonly diagnosed in adulthood. It is more prevalent in people of European descent, but can occur in any population. Early diagnosis and treatment are crucial to manage symptoms and prevent complications. The hallmark symptom of DH is the appearance of intensely itchy blisters and rashes. These eruptions are usually symmetrical, meaning they appear on both sides of the body in a similar pattern. Common sites include the elbows, knees, buttocks, back, and scalp. The itching can be severe and often worsens at night. The blisters may be small and clustered or larger and more spread out. The affected skin may also appear red, inflamed, and feel burning or stinging. The intensity of symptoms can vary from person to person. Some individuals may experience mild itching and a few blisters, while others may have widespread eruptions and severe discomfort. It's important to remember that DH is a chronic condition. This means that symptoms can come and go in cycles, with periods of flare-ups and remission. The exact cause of DH is unknown, but it is strongly linked to gluten sensitivity and celiac disease. When individuals with DH consume gluten, their immune system reacts abnormally. This immune response leads to the formation of antibodies that attack the skin, resulting in the characteristic blisters and rashes. Diagnosing DH typically involves a combination of medical history, physical examination, and laboratory tests. A dermatologist, a doctor specializing in skin disorders, will examine the affected skin and inquire about the patient's symptoms and medical history. Blood tests are conducted to detect specific antibodies associated with DH and celiac disease. The most common blood test is the IgA anti-tissue transglutaminase antibody test. A skin biopsy, where a small sample of affected skin is examined under a microscope, is often performed to confirm the diagnosis. During a skin biopsy, the doctor will numb the area and remove a tiny piece of skin. This sample is then sent to a laboratory to check for the presence of IgA deposits, a hallmark of DH. While there is no cure for DH, the symptoms can be effectively managed with a strict gluten-free diet and medication. Eliminating gluten from the diet is crucial for controlling the autoimmune response and preventing skin eruptions. A gluten-free diet involves avoiding all foods containing wheat, barley, and rye. This includes bread, pasta, cereals, pastries, and many processed foods. Fortunately, there are many naturally gluten-free foods that are staples in Indian cuisine. Rice, lentils, beans, vegetables, fruits, meat, poultry, fish, and dairy products are all naturally gluten-free. In addition to a gluten-free diet, medication may be prescribed to manage symptoms, particularly during flare-ups. Dapsone, an anti-inflammatory medication, is commonly used to reduce itching and suppress the immune response. It is important to note that Dapsone can have side effects and should only be taken under the supervision of a healthcare professional. Don't forget to like and share the video to someone who may need these tips. And while you're at it, subscribe to join our community of healthy humans.